Welcome to Seniors on the Move. My name is Karen McKenzie, and you all know me. And today we're going to talk about feet. Are you paying enough attention to your feet, especially as we age? So this is a show for seniors mostly. So we have two doctors with us. We're lucky enough to have some doctors, and I'm going to give you some information on each one. And the first one is Dr. Franger, Elizabeth Franger. She attended the New York College of Podiatric Medicine, and after receiving her doctorate of podiatric medicine, completed a rigorous 3-year surgical residency program at Good Samaritan Hospital, a level 1 trauma center in West Islip, New York. And she was the chief resident during her 3rd year of training. Wow. She also worked as an orthopedic in an orthopedic office where she learned from podiatrists and foot and ankle surgeons how to treat active individuals like us, right? Conservatively and surgically, so that's interesting, and get them back on their feet. Dr. Franger also, she spent time at St. Catherine's of Siena Wound Care and Hyperbaric Center. Did I say that okay? Yes. Hyperbaric Center?
That is correct.
She's also had comprehensive exposure to forefoot and rear foot surgical cases, including arthroscopic and minimally invasive surgery. She loved rowing in high school, really. Mm-hmm. That's hard work. And continues to run and participate in marathons. I don't know where doctors find the time to do that. But her husband is Dr. Frederick Kaestel, and he's also a podiatric physician and surgeon, originally from Long Island, New York. Dr. Kaestel graduated from SUNY.
Yep,
and
SUNY.
Plattsburgh with a Bachelor of Science in Biology, magna cum laude, and then attended the New York College of Podiatric Medicine in New York City and obtained his doctorate in podiatric medicine. He completed his postgraduate residency in podiatric medicine and surgery at the prestigious Long Island Jewish Medical Center, North Shore University Hospital, Level 1 Trauma in New York. Boy, lots of titles here. During this time, he received thorough pediatric training at Cohen Children's Medical Center, New York's largest Level 1 pediatric trauma center. That's very interesting. As well as extensive wound care and limb salvage experience at Northwell Health's Wound Care Center. If I'm mispronouncing, please correct me. In addition, his comprehensive training in elective surgery, arthroscopic surgery, as well as reconstructive and trauma surgery of the foot and ankle. He is also trained in the latest non-surgical and minimally invasive treatments of common foot and ankle conditions, of which I'm sure there are many. Dr. Kaestel is an outdoorsman and marathoner. So do you do the marathons together?
Yes.
Oh, that's wonderful.
Sometimes.
Are you competitive? I mean, just
yes.
Yeah. Which he feels has helped him to understand what it feels like to be in a patient's shoes. He is compassionate and takes his patient's goals and lifestyle to tailor the best treatment for each patient. I wanted to start off today with Dr. Robert Franger, who was Dr. Franger's father, who was on the show a few months ago. And what he said was that he felt that we should get a yearly foot exam like we do, a dental exam. I think that's extremely important. Why don't people do that, especially seniors? Let's start with seniors.
Exactly. I feel like some people, you're on your feet all day, every day, and little aches and pains can become big aches and pains, and, taking care of it early on and just getting yearly checked to say, okay, everything looks good, or here's some things we can work on. It can be as little as a shoe change, an orthotic, things like that, but it's just good to check everything out, make sure everything's looking
So it's
good.
prevention, isn't it?
Exactly.
Absolutely.
Don't wait until something awful happens.
Exactly.
And unfortunately, I feel like most people don't think about their feet until there's a problem. So early intervention is always the best course of action.
Now, I don't know if you can tell yet, but do you have any idea what percentage of your patients would be seniors? Again, where this is a show for seniors.
I'd say probably about 40%.
I wondered about that.
Yeah, and within that, some of the main things we're concerned about is diabetes, which is a big problem in our country and overall, but in seniors especially, and also any vascular disease and things like that. So
Sure.
that's something that can be checked yearly, but we look at every patient and kind of come up with like a more individualized treatment plan, like come back every 3 months if you have any problems, things like that.
All right, and I will be your patient, so you can use me as an example. Okay. Now, I've been to the office, of course, with your father. How are you going to manage both of you in practice in the building you're in now? What do you have to do to the building? Are you totally renovating, or?
Yeah, so I've begun renovations at the office in Main Street. In the process, we're still going to be open during our renovations, so going
Okay,
bit by
that's
bit.
good,
Started
good.
with the entranceway. All of the rooms are being repainted and redone. All the flooring will be redone. We're investing in new technology to make everything more streamlined in the office as well, so that way it can be a state-of-the-art foot and ankle facility for Central
Speaking of
Mass.
state-of-the-art, what about equipment? What is new and exciting, you know, in
So
what you're
we don't
doing?
currently have it, but ultrasound is a big part of podiatry practices now. So
Really?
that's something we're definitely looking forward to in the future. As far as other advancements in specifically podiatric surgery, a lot of the times elderly patients were told they weren't necessarily candidates for certain surgeries. I have many older patients that have significant bunions, hammer toes, and that was mainly due to the large incisions that were required to correct them in the past. Now with minimally invasive surgery, we're able to correct and do similar procedures with no more than 1/4 of an inch incisions. So the technology's moved pretty much all through medicine and surgery to become less and less invasive, but try and produce the same great results.
That is
Exactly.
wonderful. Now, there's 2 of you, so how will you work that out also? Will each of you specialize in something different or work on the same projects together?
So we do a lot of the same thing, just how we were trained. But some things I'm more probably interested. I would say I do love sports medicine. We both do. I mean, we
Of course,
have
there's
run
lots of runners and things.
and all of that. So I think that's really fun, and just keeping people active for as long as they can, I think, is really important too. We do a lot of wound care as well. So with diabetics and things like that, wounds are a big problem and can have serious consequences if they're
know.
ignored or left untreated and things like that. So those are a couple things I'm interested in.
Yeah, there's definitely a lot of overlap between both of us, especially when it comes to senior care. We're both very well trained when it comes to preventative care, whether it's diabetic or another aspect is vascular patients as well. Vascular meaning the blood flow isn't as great to the feet or the lower extremities as possible. I think a big change throughout our profession too is we work hand in hand a lot with vascular surgeons to basically assess, make sure small problems don't turn into big ones, because someone with less than adequate blood flow, all of a sudden stubbing a toe can become a lot more of a big deal. So, and I think a lot of patients too, like we said, about 40% of our patients are elderly a lot now. I think it could be a lot higher. It's just the fact that unlike seeing their primary doc every year, they don't know they should see a foot doctor once a year.
Can we talk about wound care? The outlook for that is better now, isn't it, as far as being
Yes.
able to do something for these people so
Yes.
they don't lose a foot or
Exactly. Yeah.
whatever you
so-
want to say about that, I'd love to hear.
Yeah, so we do a little bit of wound care in our office, but there's a lot of advances with grafts that are made from, I mean, there's like cadaver grafts, which is like a nice option because it's still human skin essentially, but it's not creating wounds in other places when we have to take grafts for big ulcerations on the foot. Those are usually done in like a wound care center, which podiatrists are also highly involved in usually.
Yeah. I think it's also important to look at what is the root cause of this wound. And a lot of times in the foot, it's because of pressure. And offloading, whether it's between orthotics or certain types of boots, or in certain cases, tendon balancing surgical procedures, all of these can play a combined role into closing a wound and getting a person wound-free and back to ambulating normally as quickly as possible. So that field is greatly evolved in the last decade or so.
Does this have something to do with being enclosed in, for the wound care, for the healing? Isn't there some kind of a thing where it looked like I saw a plastic thing once, someone was sitting in it for wound
Yes.
care? What is that? Or what do you call it? That is the hyperbaric.
Yeah, so there's hyperbaric medicine where you're in a chamber and it's high, basically pressure oxygen kind of, and it helps bring more more oxygen through the bloodstream. So that's definitely an option. There's locations in most wound care centers that have those as well, but usually, as we've been saying, diabetics and vascular patients usually do really well with those, and that's just another modality for wound care that's very helpful.
Do they also have to take medications, people with this problem, in addition to the the wound, actually the wound itself?
So vital things for wound healing, especially in the diabetic patient, is getting their sugars under control. So it's usually modern podiatry and medicine, it's now a multi-team approach. So we're constantly coordinating, whether it's a primary care doctor, an endocrinologist, and a vascular surgeon, making sure their blood flow is adequate, making sure their sugar is extremely well controlled. And then part of it too, especially for wound healing, is nutrition. If patients don't have adequate nutrition, it's going to impact their healing negatively. So it's now a multi-team approach.
That's sad.
Yeah.
So are there less amputations, leg amputations? Or
there are, with preventative care is what we're saying too. I think the other issue is a lot of times is neuropathy plays a big role, which I don't know if we really touched on too much. But
so for those that don't know, neuropathy, there can be many different causes, but the most common now is diabetes, but it can present as tingling, burning, and numbness. And due to the high sugar, the sensation in the feet isn't quite as great as a normal person, and a person may step on something, cut their foot, they don't necessarily know, and then something that could have been small leads to a big infection.
As we get older, we don't feel the ground like we used to, whether you're apparently whether you're a diabetic or not. But I'd like to talk about balance a little bit. What do seniors need to know, or what do they need to wear to improve their balance? Anything you have to say about balance, I would love to hear it.
Yeah, definitely making sure that the ground is clutter-free and the home is one thing, because that plays a role in balance and fall risk as well. But any sort of stable shoe is great. We usually recommend like a New Balance, either slide on or even Velcro strap, just that has a really sturdy base, even in the house is good too to wear. And then having the right assistive devices as needed, so any like canes, walkers, things like that, I think can help a lot.
Yeah, absolutely. And I feel like a lot of seniors that do have a fall may not necessarily use their cane or walker that was dispensed to them, and my urge would be to please use it as much as possible.
Yes.
What about children? What happens with children mostly? Injuries and things? Do you see a lot of that?
I'd say so I trained at Cohen Children's in New York. So I saw a lot of pediatrics. It's majority, I would say, trauma related, whether it's fractures, sprains, trips and falls along those lines. Good amount of foreign bodies, kids stepping on things, ingrown toenails. I also treat certain congenital and developmental issues too, like toe walking, flat feet in children are extremely common as well.
Yeah. All right. Well, we need to really look into that. Now the yearly checkup thing. What would you look for in a senior?
So
Obvious.
Basically, we go
problems.
through like the systems. We look at the vascular, if there's any vascular issues. Do they have pulses in their feet?
Yeah.
How are their feet feeling to them? Like burning, tingling, numbness, any like sensation changes. Another thing that can affect seniors a lot is arthritis and like arthritic changes.
Yeah, forgot about
so
that.
any joint in the foot can have arthritis too. So there's obviously a good amount of treatments that we can do in the office to kind of help alleviate some of those symptoms as well. So those are some of the things we look for in like a yearly exam.
Part of it too is a full dermatological exam on top of it. So assessing the skin, assessing the nails and the thickness, assessing for any wounds, any kind of trophic changes or anything that could raise a red flag.
Yeah.
I don't know if this sentence makes any sense, but the philosophy of change. What is different about podiatrics today than it was maybe 20 or 30 or 40 years ago? Anything new or anything
Definitely.
you can tell us?
I think one thing is that we do nail care and things like that, but we're not just cutting toenails. Like, I think that was kind of the view of podiatrists for a long time.
This is a good point.
We're just gonna, cut toenails, but like, I mean, there's a lot that can be behind it, which is what we've been talking about during this time.
Yeah.
But I mean, we do so many more things. We can treat the ankle at this point, treat ankle fractures, ankle sprains, wounds around the ankle and calf and everything like that. A lot of skin conditions, skin cancers we've even seen, and things like that. So I think it's just evolved from just that very basic, like, oh, all they do is cut toenails. Like, that's not all we do. So that's one point.
Yeah, the training has definitely evolved the most. We both did very thorough 3-year residencies.
I can't believe your education and all
in the past, many podiatrists either didn't do a residency or they just did a 1 year, whereas now it's standardized. You have to do 4 years of undergrad, 4 years of podiatry school, and then 3 years of reconstructive surgery, and some even go on to do fellowships now. So I think the education has greatly improved, and the connections now we've made with other specialties, it's more of a team approach than it was in the past. So working with the other parts of healthcare, including primary care and other specialties, I think has been a huge boost for the profession and for the care of patients overall.
Wow. So I'm glad we had the show, if it's only for that reason, to educate people. What else can you tell us? Is it something that's really amazing coming up besides all the other things that you told us? I didn't realize how much of the body is involved in the feet. That's another thing. Can you tell us a little bit about that?
Yeah, so I think podiatry is an interesting specialty, the fact that we're focused on a region of the body. So as part of that, you have to know a bit about everything. So you have to know a bit about dermatology, you have to know about blood supply, nerves, orthopedics, the muscles and bones of it. You need to know about systemic arthritis, so you have to know about rheumatology, and you have to kind of bring that all together for one specific area of the body. So,
do you work with handicapped children?
Yep.
And give me an example of what that would be.
So, I mean, some of that is like what Fred was saying, with like any congenital deformities too. Sometimes if there's disabilities, it does affect the feet as well. What can be difficult is assessing how much pain a child might be in, but we try and manage that. I've done braces for children that have different disabilities in their lower extremities and things like that. So we do all like custom bracing, custom orthotics for kids as well as adults, but it's a little more delicate in the kids, I would say, because you have to make sure that they're like comfortable wearing it, I would say.
Sure.
Yeah, especially if they can't express necessarily how they're feeling. So.
Did you want to add something to that yourself?
Yeah, I was going to say with children with disabilities too, I've seen a lot with very flat feet. Sometimes it can be part of their condition. Sometimes it can be unrelated, but we've been able to address them both either by orthotic therapy, and if all that fails, there are a lot of surgical options for flat foot reconstruction and
really?
Actually, yes. And
so
actually,
it's not just putting something under the arch.
No, my comparison was always there's two ways to fix a table with one short leg. You could either put a coaster under it, or you can actually fix the leg itself. So now with advances, we can do that. So.
But I think in a lot of cases you try to avoid surgery.
Yes,
think
absolutely.
Maybe.
Yes, that's always like the end line kind of thing. Like when all else fails, we think about surgery. But it's just always an option too. We also look to see like how much is it of any condition, like an arthritic condition, a flat foot, bunions, hammer toes, like is it affecting their daily life? Because if it's affecting their daily life with all this other conservative stuff we're doing, maybe it's time to consider surgery to fix the underlying deformity. That's how I kind of look at it.
The goal is to always get people back and going to what they want to do with their day-to-day life as quickly and efficiently as possible.
But it's a big responsibility. The things that you need to know, Do you have like a checklist? You're always hearing about checklists. Dr. Atul Gawande, I don't know if you've heard of him. He's written a book about what medicine is really like, you know, inside. And he talks about something as simple as a list, like sometimes when there's a surgery and maybe it's rare, but a surgeon will forget a step or leave something inside of a person. But anyway, we won't go into that. I'm sure you folks aren't going to do that.
I have woken up in the middle of the night concerned about a post-op patient. Like, I hope they're okay. I hope everything's healing well.
So you have compassion too.
Yeah.
Then.
So we definitely worry about things, but we've been trained very well.
Exactly.
So you know, we're prepared for pretty much all scenarios with the training that we've had, and any complications too.
You're going to do very well, I'm sure. I have a question that's kind of personal. There's an ad on television about inserts for shoes and things. And these people say that it healed their back problem. They have no more back problems. Is it possible if you're wearing the right, what do you call it, orthotic?
Like orthotic.
Yeah.
Yeah, so it is possible.
Explain that to me.
Exactly. So when you're purchasing an orthotic, it's from a trained professional, either a podiatrist like us or a foot and ankle surgeon. It's not just the material that's going into it. When a prescription orthotic is made, we're taking into account the biomechanical exam we did. A lot of times measurements are done. A lot of times a gait exam is done, including a 3D image of your foot. And we use that as basically a starting point, and with what we found in the exam, to create that prescription orthotic to address those specific issues. A lot of ones with these like online step in the box make their own orthotics. They're not positioned in the right thing, and they're not bringing in the actual technical component of the prescription. So a lot of times these self-made inserts or orthotics, they don't always address the issues because they haven't actually had a professional write them a script for it.
So is it a misalignment?
It can be.
Type of thing where that can bother your knees?
Yep, so your feet are basically the foundation of your whole body. If even a little bit is off, the rest is off as well. So being in a little bit better alignment, especially people with flatter feet, it can improve knee pain, back pain in many instances. So it works its way up.
And say the thing is too, if someone's had an injury to another part of, like either their knee, ankle, even back, if there's any discrepancies, sometimes people compensate on the other foot and leg, and they can be thrown off. So sometimes an insert for like a discrepancy like that can help and improve like the back pain, but that's, you know, just kind of alleviating the symptoms of maybe an underlying issue.
That's interesting. What part or how much effect would a knee that's out of alignment? I know the patella kind of moves around in there, doesn't it? Do you have anything to do with knees? Do you check that? You must check all these things. I'm sure you do.
Yeah, so we do a full exam for all parts of the bodies. We're mainly focused on how the foot and ankle could potentially impact the knees. Like I said, now we're part of, we work with other team members too. So if we can address it through some therapy at the foot and ankle, we'll do that. But if it does require actual intervention to the knee itself, we'll work with orthopedists or other specialties. I'm going to have a lot of questions for you when I come in. Okay, so this is my first visit. What is the first thing you do when I walk in and say, I'm here? What do you do first? Do we have anything to fill out or anything like that? Not today.
Not today. Mostly just asking what's been going on, what's bringing you in, and then we kind of take it from there and try and pinpoint if there's a specific issue or just some preventative stuff to do. That's usually for our new patients.
But good fitting shoes are really, really important, and how many people have them? So like you say, we should practice prevention and just come in earlier.
Exactly.
And we are on our feet all the time. I don't sit down during the day at all. I've been lucky so far. I can still walk, I suppose. But I love to dance. I had a dance school for a while, and I teach exercise, and we do aerobics and things like that. I still think movement is important, especially as
definitely,
we age.
yeah, and it definitely just keeping mobility, keeping strength up, makes us all stay independent for longer too.
Eating properly. And
exactly.
things like that.
High protein.
We have about 3 minutes. Is there anything else you'd like to say? And if not, we would just like to have a contact number from you.
Yeah.
What is the name? What is the name of your
So our new
practice?
practice is Shrewsbury Podiatry.
Easy enough.
Yep, we're located right in Shrewsbury, right
in the
on Main
center.
Street, across from
I
the
think
library.
it's near the center. Is it
Yep,
near the
Yep.
center?
right near the
Yeah.
center.
Across
Yeah.
from the library.
Oh,
Yep,
Yep.
across from the
Okay,
library.
good.
I don't know what our current phone number is, but
I
we're
do.
currently undergoing renovations and improvement. There'll be an
That's
improved sign up
okay.
front too, so we'll be a little easier to find as
Exactly.
well.
what about a website?
Yes, so our website's shrewsburypodiatry.com.
Easy.
Our phone number is 508-842-7910.
All right.
And we're pretty much there 9 to 4 every day. Fridays we're
Oh.
open 9 to 12. 'Cause in the afternoons we usually have surgeries and whatnot. That's kind of our block time. But yeah, so we're pretty much taking new patients anytime, any day.
We have slots for emergency appointments as well. And
We didn't
in
ask
severe,
about that. Yeah.
In severe
Yeah.
cases too, we both take call and have privileges at St. Vincent's Hospital. So
So you
we
can
work.
depend on each other. That's wonderful.
Yeah,
Oh,
it's
that's
been
great.
very nice. So
My first job when I was 16 was at St. Vincent's Hospital, the old one on Vernon Hill. I made 70 cents an hour, and I worked in the kitchen.
doing good.
That's telling you how old I am, and I really shouldn't.
Oh my
But
gosh.
I'm thrilled to have you both here.
Thank you for
You're
having
going to
us.
be very
Yeah.
successful, I'm sure.
Thanks.
And I'm glad I have you all to myself because I live right near you, right?
Exactly.
So thanks for tuning in, and I hope this information helps you and you realize the importance of taking care of your feet. You want to have happy feet. So just keep moving, wear the right shoes. Give these folks a call. Thank you both again.
Oh, thank you so
Thank
much for
you.
having us.
Good luck,
Appreciate it.
and we'll see you next time. Bye for now.